Hello, friends. A very good day to all of you out there, and a very, very warm welcome from the entire team of RFA Tutors. Thank you so much for joining in. A wonderful start we are expecting from all of you, and we all are very excited for you guys to start up MRCOG Part 1 journey with us today. Thank you very much. We wanted to meet you guys before we take a formal start of the course. I'm sure that you guys are having lots of questions. Many of you are picking up the books after a long time. Many of you are not very, very familiar with the obstetrics and gynecology. So we are here to address all your concerns today and answer all your questions before we make it a success together, hands in hands with togetherness as a family. Thank you very much. Hello, Safa. How are you doing today? Warm welcome, sweetheart. How's everything?
Hello, ma'am. Yeah,
I'm
I'm fine. Very glad to be here with the introduction session.
Thank
We
you
are
very
starting the July course.
Absolutely. So aiming for MRCOG Part 1 July 2025, we always say that is it an easy exam? Students would ask how much time is enough? They would be asking, we don't know anything. We have forgotten anatomy, physiology. Would the course be sufficient? What books we need to study? Would we have to take something else as a study as well along with the curriculum? So we are here for all the answers for this question today. We have to make it a success. This is a doable exam. In fact, college wants you to pass this exam. Everybody is so supportive for you guys when you're taking this exam. So what is the agenda today? Why to take MRCOG Part 1 at first place? What are the prerequisites for MRCOG Part 1? What do you need to have before preparation? How to prepare for MRCOG Part 1? Very rarely, but if at all somebody's failing, why do the students they fail and how to make it in one go? Thank you very much, Mahitab. Hi, Amna. How are you? Krishna, good to see you, my dearest. Thank you so much. All right. So with all this, why we are taking MRCOG? Of course, we all want to have this prestigious degree being part of the Royal College of UK. We definitely want our credibility to be higher. Competency level, of course, increases. We are getting more information with all the steps of MRCOG, and it's globally recognized qualification. What are the prerequisites of Part 1 preparation? Safa is going to take over and she would explain to you guys that what are those important elements that you guys should have before we aim for this exam, please. And we get ready for this, please. Yes, Safa, you're mute. Please unmute yourself.
Okay, friends. Actually, before applying for the eligibility, you have to make an account in the RCOG website. So previously, the eligibility criteria is different. Nowadays, college has changed. Few changes are there. We have to fill up the eligibility form in the website itself. Okay. And then after that, you have to send the expression of interest, fill up the form. Okay. These are the 3 steps you should do. First, you have to make an account. After making an account, you will be given one number. That will be your registration or COG number throughout your MRCOG journey. Okay. And then eligibility criteria form, it is available in the website itself. Okay. Next slide, ma'am.
Yes, please. How to make the RCOG account? How do we do that?
Yeah, this will be available in the website. You just, if you click the right corner, there will be make an account. So you just fill up your details like your name, address, everything. And then you will get a mail about your number. It will be done within 48 to 72 hours.
Absolutely, yes.
Is it clear?
Yeah, I'm sure that you guys are understanding. If no, please do ask because this is a very important question, and this is something which is the first question which you guys always have before you're starting the preparation. So eligibility form that has to be done, expression of interest, we are going to announce in the group as well. And when it will be open, you
So
people
you have to click this one, the previous slide, ma'am. If you open in the website, it will be there. Okay, you have to click this eligibility form. So it will take you to that page. Okay. Then you have to fill up all the details. Along with that, you have to upload few documents. Previously, they asked for only the your primary degree, that is MBBS degree certificate. But nowadays, they are asking for the ID as well, because there will be too much of discrepancy in the ID, which is making the students not attending the exam in the Pearson Center. So,
Absolutely. Kendra wants to say something, Safa. Please, Kendra, we're here to listen to you.
Okay, so I would have done all of these that you said that we have to do, but I did this probably more than 6 weeks ago. How long does it take for you to get back information that you would have gained eligibility and that they received your application?
so yes, dear, actually, they will take at least 6 to 8 weeks time. Sometimes they will take more than that as well. But once the deadline is over, surely you will get the reply from the college. Okay, now the deadline is March 25th is the last date for eligibility. Okay, so most of the candidates will get reply after that. Is it clear?
Kendra, did you understand that? Yeah. So
Yes, I
probably,
understand.
yes, another 1 to 2 weeks, we're expecting a reply for you. Yeah. Okay,
Okay,
great.
thank you.
Yes, Safa, please. Yes.
Yeah, so you have to submit your ID and then your certificates. Okay, after that, you have to fill up the expression of interest form.
Absolutely.
And
Yes.
you will get a reply within 8 weeks, or sometimes they may take time till the last date of eligibility form.
Yeah. So what documents have to be there, Safa?
Documents only, it is only primary medical degree certificate and the registration certificate. We have to just scan it, that's enough.
Absolutely. All right. Okay, so MRCOG Part 1, make sure that when you make your account, the number, the name, email address, the name, if it is your passport name, that would save you with so many problems which can happen later. So many times you put the name which does not go with your passport, with your identification. Today you take it easy, but tomorrow when you are in the Pearson Center for your exam, unfortunately, so many students, they cannot appear because their ID check gets failed. So I know that we girls, we get the change of names after marriage, or the maiden name gets changed at times. The Gulf IDs, they do not correspond. So I would like to make a humble suggestion here. Please make sure that whatever you put the name, either you get the document from the college that is different from that of my ID, or it's better that you give that name which actually is with your ID, which goes with your passport, which goes with your national country identification card, right? So when is exam in MRCOG Part 1 July 2025? We are aiming to start. When is exam, Safa? What is the expression of interest date? You're mute, my dearest.
Exam date is on July 1st, it is Tuesday, 2025. Then the expression of interest, it is last date is, it is 25th of March. Okay, and the booking window for exam booking, it will start from 22nd April.
All right. Okay. So please, these are the dates that you should be very, very clear about. And you always ask about the fee structure. The fee structures are different for all the bands. Where you are in different bands, you can see and click on this on the website. So you can see that where is your country in terms of band, and the fee structures are given there so that you're mentally ready for making an arrangement for the fee as well just now. But that will be on the date of the registration. The most important question, how to prepare for MRCOG Part 1. We have modules, and the modules are those basic modules that make you dive into your medical school. The same medical school topics like anatomy, embryology, physiology, biochemistry, endocrinology, biostatistics, genetics. You have the pharmacology, microbiology, immunology, biophysics, pathology, and you have session with me, the clinical management and data interpretation as well. When we divide into sections, we should be very clear before we aim for this exam that how much is the composition from each part. Why? Because as a student, we should be able to give that much attention to that specific subject. So we do know that how important the anatomy is, how much score we need to get for the embryology, how much preparation we need to have from endocrinology. All this has to be known today so that you're very, very focused in your preparation. So how do we divide this in terms of paper one? We have anatomy, biochemistry, embryology, endocrinology, biostats, genetics, and physiology in paper one. There can be a little shuffling, not a major shuffling, but there can be little few questions up and down from the first. The second one is biophysics, clinical management, and data interpretation, immunology, microbiology, pathology, and pharmacology. In this, again, it is very, very important that you guys know that this is how the division would be. Please go ahead with the exam format, Safa, and tell them that how do we do the preparation with them.
Okay, friends. So your exam will be online. Okay. You will do this exam only in the Pearson Center. It is a computer-based examination and the language is English. Okay. You have two papers, morning one paper and afternoon another paper. So in each paper, you will have 100 questions. It is only single best answer. They will give you 5 options. Among that, you have to choose one option. Okay. Next page, ma'am. Okay. Is it clear, everyone? And very good thing about this exam, there is no negative marks. So you can attend all the questions. This is the pattern of the exam. Do you have any doubts? Any doubts?
So you guys understand the paper pattern, right? So please keep a note of this, that we do not have 3 hours for this, unlike MRCG Part 2. We have 2.5 hours for the single best answers paper 1. That makes around 150 minutes, and 100 single best answers we have to do. 2.5 hours we have for the paper 2, and in between we have a break that can be 30 minutes to 1 hour approximately, where you can take a break and then you have to do your 100 single best answers. Generally, time management is not an issue in MRCOG Part 1. I mean, I'm yet to see any mentee saying that, ma'am, I couldn't complete. In fact, I have to tell them, please hold on. Do not leave the Pearson Center earlier, because always we start getting messages, exam is done like 20, 30 minutes earlier. So I'll be very strict with them that please don't be hasty and don't leave the center. Generally, they tend to complete the exam quite early for the Part 1. So the Pearson Exam Center, there are different in different parts. There are certain ID checks that you guys have to do, which Safa would explain, because every time, unfortunately, few students, they cannot make it because of the lack of the identification. And we are very helpless at that time, because the Pearson is a third party and they cannot agree to what you guys have as a passport unless you've got a permission letter by college. What do you suggest for the ID check? Though we'll have lots of meetings before the exam, and we do keep on telling you, but just from today, if you guys know this, at least you can make the arrangements accordingly. Yes, please.
Yeah, nowadays college, made it easy that in the eligibility form itself, they are asking for the ID. That ID to be issued every time in a Pearson Center, MRCOG Part 1, Part 2, and Part 3. So when you are sending your eligibility criteria, that time itself, be careful which ID you are sending. If it is a passport or your driving license, it would be better.
Anything which is actually similar to that of your RCOG name, I think that would be great. But because you have to send and make your account now, so we strongly suggest that you guys make it according to your passports or your identification cards for your country, right? That really helps, please. All right, so we have got Preeti here, our master in anatomy. Students, they say that when it comes to anatomy, Preeti ma'am makes it super easy. And Preeti ma'am makes us learn so well. I'm super proud of her having a very good grip on this subject. For anatomy and embryology, you will meet her for the live sessions. So can I have Preeti here for the explanation of how anatomy goes and what is the expectation in anatomy, please?
Hello, students. So we are going to begin with anatomy itself soon. Uh, am I audible?
Absolutely audible, visible. Preeti, go ahead.
All right. Okay. So, in anatomy, we have the pelvic bone, we have the fetal skull that comes as the questions. Then, basically, we have questions on the engaging diameter of the fetus. Then we have the anterior abdominal wall, the femoral triangle. So these all we just master it. Then the blood vessels of the abdomen and the pelvis, and the vulva and the perineum. So this is how we have divided. Then we have few miscellaneous questions also, but this largely covers the most of the part. Additionally, we have questions about the pelvic organs like the uterus and the urinary bladder and the surrounding structures. Basically, all the structures which are likely to be injured or affected during our surgeries. So we have to cover all those parts. And I have made a lot of mnemonics for you, which I believe they help the students a lot. So we go with those in a flow to, cover all the questions. And I try my best to make your memory very good, because in anatomy, see, all of you know it, but the way they ask the question, they trick you. They ask you things which are common. Maybe the beginning part of, the name of the artery is similar. So then, you'll get tricked in that. So I try to make sure that that doesn't happen. Anatomy carries a lot of weightage, not only in the exam, but also in life, because if you know your anatomy well, your surgery will go well. Now, in embryology, we have development of, we have the some part for the gametes. Then we have the development of each and every structure. There are a lot of questions on structures arising from the endoderm, mesoderm, and ectoderm. Then the development of the pharyngeal arches. So we make all mnemonics and make everything easy. Then the genitourinary system, the development of these structures, then the placenta and the fetal circulation. So these are the main questions that get covered in embryology. And both these subjects, I give you a lot of mnemonics because they are like maths. And if you remember in a sequence, both will be linked to each other, and you will not forget both these subjects, and they will remain with you forever.
So,
So,
Preeti, how many questions do they expect from embryology? Because students, they do say that it's quite volatile and it's not very comfortable studying pharyngeal arches or for that matter development, because it's just like imagination and, it becomes quite volatile and requires revision. So how much content do we expect from embryology? Tell the students, please.
So, embryology in the paper, there are 7 to 8 questions in the paper, and anatomy, there are 15 questions approximately per paper. So that totally contributes to about 22 questions from both these together. So that's nearly 1/4 of your paper. It may be one question plus minus that may come. But if we do it together, I'm sure you will have a very good memory. And in fact, last batch had no problem at all. And many of the questions which have not appeared previously also I cover. So whenever we are having the sessions, make sure you hear each and every part of the session. There are questions which we have discussed that have come for the first time, and they've never come before also. So I cover that up also as a complete subject.
Absolutely, my dear. So much. Thank you, Preeti. You guys would have the first session. We're going to start from anatomy and embryology, and I'm sure when you guys would have the live session, I always get this feedback that now we are understanding that how we have to study, how we have to make it easy. And whatever you're going to have in the live session that will be uploaded on your portal, you can revise it as many times as you want. If you ask me as a mentor, anatomy and embryo does require revision. But when my part 1 students, they come to me in part 2, when I teach them the TOG article nerve injuries, when I teach them for the surgical and post-operative complication module, the vascular injuries, and when they say, Preeti ma'am made us remember this, Preeti ma'am made us remember this internal iliac, external iliac artery, I'm always proud of you guys. So part 1 makes your solid basis. What I expect from you guys, that if this basis is strong, the journey of part 2, part 3, the building is very, very strong. So please keep it very, very serious attention towards the first 2 sessions. I'm sure that you guys would learn really well and do repeated questions for this section, please. Thank you so much. Thank you. Yes, Safa. So we have got microbiology, percentages, pictures, diseases, bugs, organisms. So how to go about this, Safa? Please unmute yourself.
Yes. So regarding the subject microbiology, you all learnt it in the second year and during your postgraduate preparation. We will just refresh all the microbiology related to obstetrics and gynecology. Mostly it will be very simple. It won't be hard at all. After listening to the sessions, all the students used to tell it is very easy. Okay. Mostly they will ask questions related to gynae and obstetrics, sepsis related organisms and PID. Okay. So according to the new updated guidelines, in every session, we will tell you what to learn and how to answer the questions. Okay. So it will be very easy for you after the sessions.
Absolutely. Absolutely.
Microbiology, along with that, we used to have 15 to 20 questions, and immunology also we have around 5 questions. So immunology also, it is very important. Like every time they will ask you about the hypersensitivity questions and then immunoglobulins. Okay, all these will be covered in a separate session.
Yes. So when you do the immunology, your tables, your slides would be sufficient and the notes would be sufficient. You guys would really be benefited by that, right?
Yeah.
Biochemistry, Safa.
Yeah. Then biochemistry, I am the one going to take the biochemistry. So after my biochemistry session, ma'am knows it will be very easy because, what is important. We are not going to write biochemistry as a one subject. It's only around 10 questions. Though it's a very vast subject, we will make it easy with the mnemonics, all the mnemonics. Okay. So importantly, we need to know about the metabolism of carbohydrate, then vitamins, though it is a very basic, we are learning since our 5th standard, but it is important for MRCOG part 1. They will be asking the question from vitamins around 2 to 3 questions. Okay. Then we will read about the cellular metabolism and then signaling, steroid synthesis. All the important questions will be discussed and you will be guided so that you don't have any worries at all about this subject.
You guys asked me, who wants to learn the Krebs cycle again? How we did in the medical school. We don't want to revise, but Safa makes you learn so much. And then you know the steps, and students, when they speak in the study group, then after the biochemistry session, we feel like revising biochemistry again and again. And to my surprise, I love it because this is that dry part. I'm sure that nobody voluntarily wants to read biochemistry. Because it's part of the curriculum, so we have to do that. But you guys would love it because we know it's dry. So we try to make it as interesting as possible. And after the session, you guys would love all those algorithms and cycles, which we used to hate, unfortunately, in the medical school. You guys would love it. And more exam-oriented discussion from the biochemistry would be there, right? So we have exam questions from the biochem, and that's really important. So we will cover all that, which is essential. Similarly, Master of Pharmacology, please, Safa, yes.
Yeah, pharmacology is very important in paper 2 because in paper 1, anatomy carries the maximum questions, like 20 to 25 questions from anatomy. Whereas in paper 2, pharmacology covers same. Okay, you will get around 20 to 25 questions. Only thing is that we used to give you reference book as an essential revision guide, but it is outdated because it is not updated for past 7 years. But we will be providing you all the information about the recent drugs from the recent guidelines and the talk articles. Okay. So what they will ask in the exam, it is all mostly drugs, what we are using in the gynecological practice and the obstetrics. Okay. So it will be, we will give you guidance about complete all the drugs, important drugs, mechanism of action, what are the side effects, how to remember, all the mnemonics will be taught.
Absolutely. For pharmacology, I would like to say that the biggest problem which I feel that when the queries come for MRCOG Part 1 is that many drugs and different recommendations, they have been changed. For example, when I was studying for my MRCT Part 2, we had a GPS guideline. We used to give clindamycin. Then after my mentorship, we knew that, okay, clindamycin is not to be selected. We have to give vancomycin, or for that matter, cephalosporins when it comes to a milder allergy or a severe allergy, vancomycin. Now, the problem with the essential guide is that it is made like long ago, and the pharmacology component is not updated. What we do is, there's a talk article recent, breastfeeding drugs. Then we have got new green top guidelines. We've got new septicemia drugs. So here comes the problem that the students who are not coached up to date, they come up with older medications, and the pharmacology questions, they are in a trouble for these questions, right? So what we specifically tell you guys is that we have to deviate from the essential. I appreciate essential revision guide is amazing. I still remember back in 2016, I marked it and I learned it word to word. But things are different for this specific module now, because we don't have everything that used to be correct. We have to go with recent RCOG updates for the drug of choice, for the second choice, and we have green top guidelines, NICE guidelines, TOG articles, and we've got e-learning strategy. So these are the followed curriculum resources for this part, please. So do not make this mistake. The drug of choice would be according to the recent recommendations and not through the reference textbooks. I hope I'm clear on this. Yes?
Yeah.
Yes, Sabha, please, over to you.
Yeah. So next come about the pathology. This is a very important, but this is somehow overlapping with the clinical interpretation. Okay. So we have general pathology questions, and they will ask questions from the benign gynecological pathology as well as from the cancers. Okay. And recent days, they always ask from staging, from cervical cancer, vulval cancer. Okay, so all these will be, we will give you the guidance in the session. What is very important, what in every pathology like endometriosis, what is important in PCOS. Okay, all the important points will be taught, and you will be able to crack the exam very easily.
Yes, please.
Yeah, then we have this physiology. Physiology will be taken by our lovely friend, Dr. Kalai. She is busy in her OT. She is not available. But I will tell you, physiology is again very important part in paper 1. This contains almost 10 to 15 questions from physiology. Mostly they will ask about the female reproductive system and then male reproductive system. What are the physiological changes in pregnancy? And sometimes they will ask about the fetal physiology as well. Okay. And we have endocrinology also in paper 1. Again, from endocrinology, you will get around 10 to 15 questions. So endocrinology, almost they will ask about the adrenal glands, thyroid and pancreas. And they will ask about the steroid synthesis, about the corticosteroids. Okay. So all these will be taught by Dr. Kalai, and mostly the reference book is Essential Revision Guide.
Now, specifically those things in endocrinology that goes with gynecology, like FSH, LH things, and when you go with the amenorrhea. So please keep a note that those things are very, very important, and you need to make a very good concept, because if your endocrinology would be strong, when we come to subfertility in MRCOG Part 2 and Part 3, the students who have got a very strong grip over endocrinology, they've got very strong module of subfertility, and they can handle the scenario-based questions in the next part really well. All right. So please keep a specific emphasis on the gynac part of endocrinology as well. Another challenging questions module, that is genetics, where Kalai is going to teach you regarding the genetics. She's master in teaching pedigrees, where the inheritance pattern or the single gene disorders are there. It is an autosomal recessive, it is an autosomal dominant, it is a sex-linked disorder. The question comes in the inheritance pattern. For example, they will just pick up thalassemia or sickle cell disease and an autosomal recessive disorder. They would ask if both the partners, they're carrier. It has to be a carrier for having a disease because it's a recessive disorder. We will explain to you that how you have to make a pedigree to find out, like a riddle, we have to solve generation-wise to make these questions correct. That if it's going to be 1 by 4 being normal or 1 by 4 being diseased and half of them like parents, like carriers, we're going to explain to you all step by step. Your genetics are mathematical questions like a quiz, like a riddle. So you should be so strong and fast in making these questions understandable. And the basic main diseases which you have to learn in genetics, the transmission and the inheritance pattern, we would give you perfect flashcards and mnemonics, and you guys would love it. That it would be on your tips that what is dominant, what is recessive, what is autosomal, and what is the sex-linked. Biophysics. We all became doctors probably because we hated physics. Yes. So still we have to do physics, but that physics which is related to biophysics. Safa, what do we cover in biophysics?
Yeah, so in biophysics, you will get around 10 questions. It mostly, they will ask questions on the how much of frequency in ultrasonogram.
Right. Safa, your voice is not audible.
Am I audible?
Yes, yes, you are.
Yeah.
Please, yeah.
Now, is it audible, ma'am?
Absolutely audible. Please go ahead. Yes.
Okay. So these are the questions will be covered mostly from the essential revision guide. Okay. And sometimes some few updates from the electrosurgical talk article also will be included in the session. And again, this session will be taken by Dr. Kalai, and it will be clear-cut session. And after the session, surely you will love it.
Yeah, the physics, the way she does the biophysics, actually your concepts will be very clear, those elements that are coming up in exam. Even cardiotopography, CTG also comes in this, right, Safa?
Yeah,
Yeah.
yes.
Yeah, the CTG is a very important part which you are going to cover in biophysics, guys, right? Okay, so once you will have a taste of Preeti, Safa, Kalai, you're going to meet me in clinical and data interpretation. So I take the last session of your preparation. By that time, you already have 90 to 95% of your preparation. So I teach you that how the laboratory investigations, when they're given to you, how do you have to interpret them? How you have to diagnose and then treat certain situations. We would also interpret certain graphs like CTG or urodynamics. We would also learn that if IgM, IgG is positive for chickenpox, parvo, syphilis, how do we go ahead with this? We would learn all the data which is given, and we have to apply that clinically and treat the patient. So this type of questions again are approximately 15. We have two types of students actually. Few students, they are very strong in their grip on obstetrics and gynecology. They are practicing and now they've decided for MRCOG-1. But I do get students who are taking this just after completing their medical school, or for that matter, having the niche of gynac by their simple 1 year practice, and they are not very sure that they've not practiced in the labor suites, they've not had the taste of obstetrics. In that situation, it's a little difficulty, I feel, for the clinical and data interpretation because the experience part is less, but that does not mean that you can't do that. You all can do it because we've got very clear favorite questions. We've got very clear favorite guidelines to be done. You are going to get obstetric cholestasis, the bile acid management. You will get chicken pox. You will get the questions from the fetal infections. If it's an acute infection, if it's a chronic infection, how to deal with that. All these things are very, very important. And with my one session, you would have a grip over 15 to 20 questions, which would be from this part, and I'll make it very easy for you guys. Another challenging part is statistics, how many questions we get from this. And we have Rini, RFA gold medalist, who's going to teach you this, and we will have Safa to practice in your study groups as well. How to have a grip over this part. Safa, if I ask you in terms of students, most challenging part of they're scared of 2 days before exam. They always say we are forgetting stats. We feel how many questions would be there. And you know what? This time students, they got a message, they got an email by college saying that they have calculators permission, which was first time. I was so happy that now the calculators are allowed because it's the first ever batch who got permissibility in part 1 and part 2. But I didn't get happiness from students. You know what message I got? Ma'am, I'm thinking that if calculators are allowed, that means that it's going to be so big statistics question. If they're increasing the stats question, I said, oh my God, we as students would always think negative, that we are in more trouble because they've allowed calculators. But thankfully, this wasn't the case, Safa, right?
Yeah. This time in
Yeah.
part 2, there is no such difficult questions on statistics.
Absolutely.
But in part 1, always they will give you around 10 to 15 questions. And this is a very important subject because it carries, the marks are not equal. The statistics questions marks are somehow weightage is more. So if you attend the statistics questions right, so the marks will be high compared to the other students. Though if you attend both of you on 80 questions correct, but you attended statistics questions correct, then the marks will be more, like 98, 97.
And do you guys know that how much RFA topper was? I mean, the record score which we had. Any guess? Maita? Kendra, any guess? How much was the highest score from RFA in MRC department? You guys will get a booster. Oh my God, we can get this. It's not impossible.
Yes, they will also get.
Yeah, they will also get that. How much was the highest percentage? Any guess at all? Kendra? No? Maita? Any guesses in highest percentage what would have been up till now? Mahita?
80%, 85%.
80, 85 is what we get in part 2.
85, every student will get.
85, you would have a huge group of 85, 85, 85. Everybody gets 85. Rizu's score was how much, Safa? Tell them.
Yeah,
Rizu,
98.
98%. Rizu got 98%. And that was a record score. Last time also we got 97, 96. But once we got 98%, and she's our student in MRCOG Part 2 now. And I'm super proud of her. I always say that this means that hardly you made anything wrong, right? So this is possible. This is possible in MRCOG Part 1, and you all can do that. All right, so you guys have got lots of lists, and before coming to part 1, you guys download these books and send us the pictures. Do we need to do these books? Which book is important? So how to go about this? So what book they have to carry, Safa? And along with the course, honestly, you don't need to do anything. You just need to do the course, please. So how they have to tackle with the preparation with these books, please, Safa, guide them properly so that they're not in any sort of a confusion while making the preparation.
Okay. So there are so many books are available with the either textbooks or as SBA books. But if you see revision notes for the Oxford revision notes is the mostly everyone follows, and then essential revision guide, that is the a Bible like Quran. Okay, that is the book we have to follow. But in that book also it is not updated. So the mentor used to tell whether to follow this book or not. Like Pharmacology, I suggest the students not to follow that book. Okay. Then this SBA books, all the books are available in the materials channel. Channel link is already provided in the Telegram group, and you can join the channel so that you will get all the PDF. If you are a candidate who used to read in the hard copy, then you can take a printout and you can have a book as a book. Okay. Or if you can read in online, then you can read from your iPad or your laptop or from the your phone as well, mobile phone. Okay. So daily we have a discussion by 2 p.m. GMT. This is a Telegram discussion. Okay. 2 p.m. GMT, our moderator will do discussion. and we will do all the possible questions from that module. For example, now we have started anatomy. Okay, so the moderator already started doing this anatomy questions daily 1 hour by 2 p.m. GMT. Is it clear, everyone?
This discussion is so important because that would make you learn that what element of your preparation is so important, what needs revision, and the practice which you guys do as a single based answer. This would make your reflexes so strong in getting up to the right answer in exam. What problems we face? It's such a high scoring exam. It's just a mindset issue. I am a very senior gynec. I've got this much clinic patients and overload. I have got theaters. I've got my laparoscopic surgeries. Can I do that? Can I not do that? Shall I take it now? Shall I take it in January 26th? These type of mindset issues keep you shaky. You're not able to prepare with focus. So what you do is that one day you're covering up the schedule, next day you're feeling, okay, it's fine, I'll take it January. Next day again, you get up, no, I want it to be done this time. Please, once you've made the decision, then you have to make sure that you do it with all your focus. Again, this entrance exam, until and unless you force the college that please don't pass me, you don't make a trial at all, then only you can fail. Otherwise, nobody fails in MRCOG Part 1. If your examination strategy is correct, if you are able to cope up with a very focused study, if you are having a targeted approach, and if you're having a very good time management, you all can do that, please. Revision guide, you can do word to word, except those parts where it's outdated, right? Make one-liner notes so that your revision is very easy, specifically for the confusion question and specifically for those volatile parts. You have to make your one-liner note so that revision in the last 1 month is very easy for you guys. Practice important exam questions multiple times because that tells you the high yield area of preparation, and these topics are very important. How to do the confusion questions is very, very important. What do we have in course, Safa? How do you make their part 1 easier, crispy, and retention power is better?
Yeah. So in our course, you all know that we have live session for all the subjects. So we have given you the schedule. It is subject wise. We start with the anatomy, then embryology, then physio, like that. Every subject will be given depending on the question, depending on the importance, around 10 days to 7 days to 10 days. Okay. So during that, and then we have the website access. You have in that there is a question pool. It contains all the subjects, each subject has around 200 questions. Okay. And then after each session is over, after each subject is over, you will have a mock. You can attend the mock. Okay. Next page, ma'am.
And mock exam gives you self-assessment that, okay, where do we stand? Where we have to improve? How the things can be better, right? Yes,
Yeah. Yeah, and also daily we have the discussion in our paid group as well as, in our open group as well. Open group around 5 p.m. GMT. Dr. Ala will be doing the discussion. It will be covering all the exam tested questions. Okay. So I request all our students, please attend both the discussion without fail. 2 p.m. GMT in our paid group and 5 p.m. GMT in the open group. Okay.
All right. Is this point clear? Because I don't want you to have a shaky start. If anything regarding navigating the website, knowing the contents, if anything is not clear, please, we are happy to answer. Ask us that if anything is not clear regarding the preparation, regarding the content, regarding the session uploading, everything is going to be there. Students have done it beautifully earlier. They all had been repeatedly being encouraged as a family in the group. They know that all the sessions, once they do, they're so strong in that content that if anything is asked, in the end, hardly any confusion question is left. So many students from the open group, they message, I mean, massively just after 2-3 days of part 1, we are getting all the registrations for MRCOG part 2. This shows that connectivity which we have with you guys from the start. So me being the lead, Safa being the chief coordinator of the course, and all the lovely mentors, We keep up the standard to the point where you have repeated revisions in every single aspect which you guys have. You're master in that, and there is no confusion when you're sitting in the Pearson Center. So when you sit in the Pearson Center, you feel that it's another day of Ala ma'am's revision, or it's another day of taking session with Kalai ma'am, Preeti ma'am, or Safa ma'am, or it's another day listening to your mentor. It's all very easy once you practice day by day following the schedule, right? If any questions are there, please, I'm happy to take the questions. If anything, you guys still are not clear regarding how the preparation is, what is the content of the exam, if you're not clear about what are the things which have to be prepared, what are the curriculum that has to be followed, this recording would be uploaded with you guys. But still, if anything is there, please let me know and we are here to answer. Yes, any question?
So this is the live session schedule. Today I posted in the group.
That's great. So Preeti, all set for 26th of January. Yes. Guys, all ready for anatomy 1, anatomy 2?
Yeah, most of the live sessions will be on Sunday and the timing will be 1 p.m. GMT.
We generally keep it that way because we want things to be very, very clear for you guys. And similarly, the daily schedule, you've got ample time to cover that module and you manage that well gradually, please. Yes, Safa. Daily schedule.
Yeah, daily schedule. Yeah, this is scheduled, this is for the daily discussion. So anatomy, we started from 21st and we will do till 31st of this month. Okay, like this, every subject is scheduled for 7 to 10 days.
Very, very important it is, please. I want consistency, nothing but consistency. If you guys stay consistent, nothing would be a problem for you guys. All those messages which we are getting on the WhatsApp, you people, if anything is there, you people want to improve as students, me being responsible for all the coordinators, backend team, and my mentors, please note down, this is my WhatsApp number, the first one, and you can drop in a message anytime. Don't see that which time of the day it is. Just drop in a message on this WhatsApp. Please feed me back how the things are going on. And if at all you want any improvement, anything you feel that have to be better, if you feel that you need some extra attention at some point, I can assign the mentor putting in those answers to you guys. But at the end of the day, when we are putting our 100%, we definitely need 200% from your side. And we're not aiming to pass this exam, friends. We are aiming to score highest so that we build a very confident start to this membership. MRCOG Part 1 Premium July 2025. You've got the link of 299, but you've got a coupon. Many of you have already used that. You will use 50M1RFA. Please validate that coupon. It's going to reduce to 139. And then you can check out validity of the coupon is 2 days. You can utilize that. And as soon as you've done that, you're going to be added in the premium study group where you will get all the data, and in 70 minutes of pre-registration, all the website access is going to be with you guys. Could I make myself clear? Yes? Great. Any question, please? Yes. Can I have all the questions? Thank you very much, Mahira. Thank you so much. So we're going to open up everybody's name. All right, Maitab. Am I clear? Myra, Noha, Haifa, Elzua. And we've got an iPhone 13. Lovely. iPhone 13 has got beautiful picture camera. Yes? Yeah? Hi, Noor. Hi, Hoida. Raven, how are you doing? Amna? Yes? Haifa has a question, please. I'm happy to take the question, Haifa.
Hi, ma'am. How are you?
No, Alhamdulillah, I'm good. Yes, please.
I'm asking about if I concentrated in the course material, I don't need to read any book anymore, huh?
Yes, yes. You don't need to read anything. Course content is sufficient to clear this exam. Okay? When I say course content, Haifa, I mean all the sessions, I mean the website questions, I mean the Telegram discussion, then yes, you're done. Okay?
Thank you very much.
Thank you very much. Thank you. Any other question? I think this question says it all, and this is what you guys want to hear. Am I right? Yesterday I got a message and that girl has just registered 5 minutes back. She'll be with you in study group. And I got a message that, ma'am, Safa, if you remember Urfa, we had MRCT Part 3 student. She was junior of that student of MRCT Part 3. She said that my senior said that if you join RFA, you don't have to see right or left in terms of your preparation. So I am picking up books after maybe 9 years and I'm a senior gynac, but I want to join this. So I just answered one thing, that please make sure that you guys stick to the daily schedule and stay consistent. It should not happen that you take it easy and you say, all right, we'll start with physiology, anatomy, we're going to revise. If you do daily tasks daily, you people would not have a problem. So this is the most frequently asked questions which we have, and that is the only thing which you guys should do. Stay consistent what mentors are teaching. Stay consistent with all those learning points which you have. Nothing is going to be a difficulty. Is that okay? Yes? Thank you so much. All right, guys, we are going to see you guys in the premium study group. The recording would be uploaded if somebody has missed some content from this. With this hope, with this prayers, that may the blessings be with us. May whatever we read together that puts in all the efforts and sacrifices we put in, that leads to the success with flying colors. Thank you so much for choosing RFA. You all are very, very strong alumni, having strong connectivity. So we as RFA Tutors team, we are here to support, and let's make it a success together. Thank you so much, Safa. Thank you, Preeti. Thank you very much to the backend team. Thank you very much to all the moderators and the coordinators for helping out the strongest alumni and making them reach to their success pathway. Thank you to all the mentees who attended the live session and the ones who are listening to the recording. Please, if any question is there, you can drop in a message in the premium in the study group and we are happy to answer. Thank you. Bye-bye, everybody. Thank you so much. The recording would be uploaded. Thank you. Thank you very much, Safa. Thank you, Preeti.
Thank you, ma'am. Thank you all, my dear friends. Let's have a best preparation and let's rock this exam.
Thank you so much. Thank you very much.